If your feet tingle at night, if your hands feel numb for no clear reason, or if you experience burning, stabbing, or electric like pain that no one seems able to fully explain, stay with me for the next few minutes. What you're about to hear may finally explain why your nerves are struggling, and more importantly, how to stop the damage before it becomes permanent. This is not about masking pain. This is about protecting your nerves while you still can. By the end of this video, you'll understand one of the most overlooked threats to nerve health in adults over 60. A threat many people are exposed to every single day without realizing it. You'll also learn what puts your nerves at risk and what needs to change. Not someday, but now. Many people are told nerve problems are just part of aging. They're told it's genetic. They're told nothing can be done. But growing evidence shows that in many cases, that story is incomplete and often wrong. Let me ask you something important. Have you ever experienced tingling, numbness, burning, or weakness in your hands or feet? And were you aware that blood sugar can damage nerves even if you've never been diagnosed with diabetes? This is where nerve damage often begins, quietly, silently, long before anyone connects the dots. Nerves are living tissue. They are not wires. They rely on oxygen, nutrients, and a stable internal environment to function properly. Unlike skin or muscle, nerves heal very slowly. That means damage builds up gradually over time. By the time symptoms appear, nerves may already be under serious stress. Here's something many people don't realize. The most common poison damaging nerves today is not alcohol, not heavy metals, and not rare toxins. It's something far more common: chronic blood sugar spikes. You do not need diabetes for blood sugar to harm your nerves. Repeated spikes are enough. When blood sugar rises too high, sugar molecules attach to nerve fibers and to the tiny blood vessels that supply them. This leads to inflammation, oxidative stress, and damage to the protective coating around nerves. Over time, nerve signals become distorted. That's when tingling starts. Then numbness, then burning, then pain, then balance problems. Neuropathy doesn't appear overnight. It develops silently for years. Many people are told they are borderline diabetic or pre-diabetic and reassured that it's not serious yet. But research now shows that nerve damage can begin during pre-diabetes almost as frequently as during full diabetes. The difference is awareness. This is why so many people say it came out of nowhere, when in reality, the damage has been building slowly for a long time. What makes this especially dangerous is that the source of the problem often looks harmless, or even healthy. Let's talk about where these blood sugar spikes come from in everyday life. One of the biggest sources is liquid sugar, fruit juice, sweetened coffee drinks, sports drinks, smoothies, even the ones labeled natural or healthy. Liquid sugar enters the bloodstream extremely fast because there's no fiber to slow absorption. That creates sharp spikes that directly irritate nerve tissue. Many adults are encouraged to drink juice because it feels gentle and nutritious, but for nerve health, it can be extremely damaging. Another major source is refined carbohydrates eaten alone. Bread, cereal, crackers, rice, pasta, especially when eaten without protein or fat. These foods break down into sugar quickly. When eaten by themselves, they flood the bloodstream with glucose. Nerves, particularly the long nerves in the feet and hands, are exposed again and again. Frequent snacking makes this even worse. When insulin stays elevated all day, nerves never get a recovery window. Chronic exposure keeps them inflamed and vulnerable. There's another piece many people are never told. Some medications can quietly worsen nerve damage by interfering with nutrient absorption, especially vitamin B12. Vitamin B12 is essential for maintaining the protective layer around nerves. Without enough of it, nerves become fragile and misfire. Certain acid-blocking medications, some diabetes drugs, and other commonly prescribed treatments can reduce B12 levels over time. Doctors often see cases where nerve damage doesn't reverse, but once the deficiency is corrected, progression slows or stops. And that alone can make a meaningful difference. Neuropathy is rarely caused by just one factor. It's usually a combination of blood sugar toxicity, inflammation, nutrient depletion, and reduced circulation. But blood sugar instability acts like fuel on the fire. That's why early action matters so much. Now let's talk about what actually helps. The goal is not perfect blood sugar numbers. The goal is stability. Nerves don't need perfection. They need consistency. Every sharp spike in blood sugar acts like a small chemical burn to nerve tissue. Fewer spikes mean less damage, and in many cases, slower progression. One of the most effective rules for nerve protection is surprisingly simple. Never eat carbohydrates by themselves. Not fruit, not bread, not cereal, not crackers. Carbohydrates eaten alone raise blood sugar too quickly. But when they're paired with protein or healthy fat, absorption slows dramatically. The same food that irritates nerves when eaten alone becomes far safer when eaten correctly. This explains why two people can eat similar foods and have very different outcomes. It's often not just what you eat, it's how you eat it. Another powerful step is eliminating liquid sugar entirely. No juice, no sweetened drinks, no smoothies. If you want fruit, eat it whole, in small portions, and always after a meal. Fruit after food is far gentler on nerves than fruit on an empty stomach. Nutrient support also plays a critical role. Vitamin B12 is essential, but it's not the only one. Magnesium supports nerve signaling and muscle relaxation. Folate works alongside B12 to protect nerve tissue. Alpha lipoic acid helps reduce oxidative stress and has been shown to support nerve health in some individuals. More is not always better. Some supplements, taken incorrectly or in excess, can actually worsen symptoms. This is why guidance and testing matter. Reducing chronic inflammation is another key piece. Inflammation amplifies nerve pain signals. Highly processed foods, excess sugar, and refined oils increase inflammation. Foods like vegetables, olive oil, fatty fish, and certain spices help calm it. Movement matters too, but it doesn't need to be intense. Gentle walking improves circulation and helps lower blood sugar naturally. Even 10 minutes after meals can make a difference. Movement supports nerves when done consistently and gently. Here's something important to understand. Nerves heal slowly. Sometimes they don't fully regenerate. But stopping progression is just as powerful as reversal. Less pain, better sleep. Improved balance, lower fall risk. Those outcomes matter. Neuropathy isn't just about discomfort. It's about independence. Feeling the ground under your feet, trusting your balance, preventing falls, which are one of the biggest threats to long-term health as we age. Tingling and mild numbness are warning signs not verdicts. They are signals that something needs to change. For the next few weeks, focus on a few simple actions. Remove liquid sugar. Pair carbohydrates with protein or healthy fat. Eat fruit only after meals. Walk gently after eating. Ask about vitamin B12 if it hasn't been checked. Pay attention to how your body responds. Even small improvements matter because they tell you the damage may not be fixed in stone. No one can honestly promise a miracle cure for neuropathy, but being told nothing can be done is just as misleading. Real progress lives in the space between, where damage is slowed, symptoms are reduced, and quality of life is protected. This video is for educational purposes only and does not replace professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider before making changes to your diet, supplements, or medications. Thank you for watching. If this video was helpful to you, please subscribe to the channel. Take care of yourself and protect your health.